Hi, everybody. This is Jim Prusak, physical therapist and owner of the Pain PT. And today we're going to talk about what I feel is one of the most important pieces to understanding and overcoming chronic pain, and that is the emotions. It's one of the areas that gets least talked about. We talk a lot about our thoughts and our behaviors, cognitive behavioral therapy type stuff when it comes to chronic pain, but there's not as much talk about the emotions. And the emotions are a critical piece of chronic pain. In fact, they are part of the pain itself. We know the definition of pain is an unpleasant sensory and emotional experience with actual or potential tissue damage. And as we move from acute pain towards chronic pain, we know from the research that pain becomes more emotional than sensory in nature. And if you haven't seen some of my other videos here about the research and the brain and chronic pain, please take a few minutes and watch them. It's going to show you how the brain transitions from sensory to more emotional areas as we move towards chronic pain. So emotions is not the same as thinking or thoughts or beliefs. Logic and emotions are not the same thing. An emotion is an actual feeling expressed by the brain and felt in the body, whereas logic is related to thoughts and beliefs that are driven from the brain. And when we're looking at the brain in relation to emotions, we're looking at what's called the limbic system. The limbic system is the part of the brain that generates, interprets, and processes emotions. And as you see here, there's areas of the brain that do this that are also responsible for pain processing as well. The amygdala is one of them that's not listed here, but there's areas that have been shown through the cortex, the hippocampus, and other areas that overlap between pain processing and emotion. So we know there's an intricate relationship between the two from the brain. Now what the brain does is it produces that signal, which then gets reflected in the body as a feeling. So emotions are all sorts of different things, from positive to negative, and they run the gamut of different types of feelings. Right? These are all emotions on the page here, and they all feel differently in our bodies. So we're talking about feelings when we're talking about emotions. We're not talking about thoughts, we're not talking about beliefs. A feeling is felt inside the body. It's a physical expression. It's an actual feeling. And I'll go on to show in some of my other videos how each of the three main emotions we see at chronic pain, what they feel like in the body, and how they express themselves. There was a really cool study done in 2013 out of Europe, looked at over 700 people, looked at Western Europeans and Asians. And what they did was they looked at where we feel certain emotions in our bodies. And what they found was that across cultures, didn't matter where you were from, people felt emotions in the same way in similar parts of their bodies, as you can see here. Really quite interesting. So emotions are actual physical feelings in our bodies, just like pain is a physical feeling in our body as well. So the two are intimately related. Now we're looking at the three main emotions that we experience with chronic pain. Typically, they're anger, frustration, irritation is one. The second one is fear, anxiety, and worry. And the last one is typically sadness, grief. So these are the three primary emotions we work with that are part of the pain itself. We're looking to work through these emotions. And how do we do that? How do we work with emotions with chronic pain? Well, the first thing is we got to acknowledge that we feel a certain way. And we do this by learning to become open to feeling what we feel in our actual bodies, because that's when the healing process starts. All emotions are meant to be felt. And when we feel our emotions, that's a form of expressing them. We allow them to be expressed in our bodies. They actually start to go away. And then we start to feel differently. But when we block our emotions and we try to change them, when we try to stop them, resist them, when we don't want them, we're actually making it worse for ourselves. We're actually keeping that same emotional cycle active from our brain to our body. And that's also part of the same pain cycle as well. It's the same thing. Emotional and physical pain are interwoven. So, what we've been talking about here today is one of the three areas. We talk about the physical level, which is your physical body. I've talked about this in some of my other videos about relaxing the physical body. We talked about the mental piece, which is our thoughts and our beliefs, learning to relax the mind, move from negative to positive thinking. And then this last piece here, the emotional piece, really important. It's learning how to relax into feelings, being open to feeling the feelings. Because again, like I said earlier, when we feel, we heal. And so you'll learn more about this if you want to find some of my other videos about the three primary emotions. If you like what you've heard here today, please give me a thumbs up. If you want, you can subscribe to my channel, The Pain PT. I'll be putting out more and more information about chronic pain and how we can overcome it. Thank you very much and have a wonderful day.